We're going to continue learning and building on what you already know. Last time we met, we practiced, we did the hands-on performing an EKG. And as you saw, it's pretty easy, pretty straightforward to perform the procedure itself. It's not very difficult to learn the wires and to apply them on the body, and then hopefully obtain a decent looking EKG waveform. That's not the hard part. The more challenging part is coming on, because you have to learn a little bit more about the EKG waveform, which is the whole point of this course. We're learning about the different EKG waveforms, how they show up on paper, and you as a EKG monitor technician, you should be able to uh, not interpret but evaluate abnormal rhythms. But to recognize abnormal rhythms, you have to first recognize normal rhythms. Okay, so what is a normal rhythm? And that's what we're going to be learning today. There's 5 very simple steps that you have to learn to follow, so that way you always go about these 5 steps. Okay, we're going to discuss them in detail. And that way, every time you see a rhythm strip, you follow these 5 steps, and you are 100%, you're going to at least get a very close idea of what the type of rhythm you're looking at. All right, so please make sure that you follow along, and take notes, or stop me and ask questions if you need to do so. Hold on one second. Do you need a laptop to follow along? Yes.
Well, I didn't bring mine.
Give me one second, guys. Charge. This is charged. But now I have. All right. Can you all hear me, Janie and Norma? Yes, excellent. Okay, since I just hooked up my microphone. So, so to be able to determine what is an abnormal rhythm, you first have to know the normal rhythm. Okay, so let's move on. There are some terminologies that I need you all to be familiar with on chapter 5. There's about 10, 12 of them, and they're very, very essential. They're very necessary that you know them, understand them, so that when we talk about, when I mention a word, please, you're able to understand. So rhythm interpretation is a very important tool for diagnosis and treatment. As we said before, it's used for many reasons. The most common reason is to have a baseline of the function of the heart at a certain point in time in your life. The next thing would be used for medical reasons, for pre-surgical treatments, emergency treatments, and so on. So again, it's important that you understand the reason why the EKG has been performed itself. And yeah, your abilities, of course, will develop over time. You're not expected to be a perfect, a perfectly knowledgeable EKG monitor technician from the beginning. You'll be learning and getting more experience as we follow along. So I want you all to remember, what did we say about the EKG rhythm and the cardiac cycle? How are they related? Remember that the P wave is represented by atrial depolarization, right? The P wave is represented by atrial depolarization. So we have the P wave, and on the P wave, we have the right and the left atrium contracting or being depolarized at the same time. And we have on paper, we have a little bit of a waveform, electrical voltage represented by a P wave. And then we have a little section, okay? A little section is a PR interval. It's from the beginning of the P wave right before ventricular contraction. So that we call it the PR interval. We're gonna learn a little bit about that in a minute. We're also going to be looking at the rate. What is a heart rate? And then sometimes we also look at two rates, the overall rate, and then we have a ventricular rate. Why? Because at times the ventricles will, or the heart itself, will have two different rates. You'll see on a monitor, you'll see uh, you're going to see the a rate of 150, and then you might also see the ventricles contracting at a different rate. When the atria and the ventricles are not in coordination, you're going to see two different rates. So we also have to evaluate the rate itself. The P wave morphology. The morphology is a term that refers to the shape, overall shape and structure of the P wave. Remember that I said that it has to look nice and round, maybe not perfectly round, but they have to be symmetrical. Remember, half is the right atrium and the other half is the left atrium. So if one of them is not looking like the other one, that means something is wrong on that side of the atria, whether it be the left or right. So we have to evaluate the P wave morphology, or the overall structure of the P wave. We are going to look at the QRS duration. The QRS is your tall wave, right? The QRS refers to the ventricular depolarization. So the QRS wave, which is a tall one, is represents ventricular depolarization. So if you remember, why do we see a tau wave? Because of the size of the ventricles in relation to the P waves, which are small atria. We have large ventricles, right? If you compare them, you have a small atrium and then you have large ventricles. So when they contract, they send out electrical impulses. So you have a small P wave, and you have the ventricles, both ventricles, they contract and they put out these electrical charge, and you see a tau surge, right? It's like a big spike of energy. That's why you see the QRS being that way. So it looks like a little cone, right? A little pyramid, and it has a certain measurements, and we're going to look at those measurements. Remember when we talked about the little squares, right? One little square is 0.04 seconds, which is 400ths of a second. It's very, very small. The QRS has a parameter. It cannot be too narrow and it cannot be too wide. So we're going to evaluate the QRS as well. So step number one, let's get started. Step number one is determining the EKG rhythm or regularity. How do you know that a rhythm is regular or irregular?
You want to go see with another professional?
No, she's going to stay here. So determining the EKG rhythm or regularity. All of a sudden got dark. Remember when we saw the EKG, the papers, right? The ones y'all performed. Most of them, the um, the diagnosis or the interpretation was normal EKG, right? Normal EKG. So there was nothing abnormal with it. So how do we know that that is a normal EKG? You saw it because you saw it printed on the paper. But if there was no print on the paper, could you tell me if that was normal or abnormal? So determining the rhythm involves evaluating the pattern. Yeah, I know. It's gonna understand. Okay. You wanna? Were you able to log in, Cynthia,
Where?
on the computer? No. No.
Oh, I didn't because I had the.
Oh, okay, okay, okay. So again, it's because the people that are online, they can't understand when I'm talking with the mask because it's muffled. But I'm wearing the mask because you're here.
Oh, I have two masks.
Yeah, two masks.
Yeah.
Because she's getting all riled up about it.
Okay. Well, if it's easier, I can just go. I can just take off. I'll just join the class at my house.
Are you sure?
Yeah, it's fine.
Okay. That way you can understand.
Yeah.
I'm recording it, so I'm gonna have it online. So if you want to see it, whatever section part you missed, you can go
Okay.
back in, because it's really, really important. On step number one. All right, so hopefully y'all are following along or writing some notes because again, this is going to be crucial for you to understand how to evaluate the EKG rhythm using the 5 steps. All right, so step number one, determining the rhythm involves evaluating the pattern of how the atria and the ventricles contract. The rhythm can occur in regular or irregular intervals. Each chamber of the heart is assessed for its type of pattern. So I already said the P wave represents the atrial contraction or atrial depolarization. So every time you start evaluating a rhythm strip, you're going to look for the P wave. What does the P wave represent in an EKG? Atrial depolarization. All right. But what sets off the contraction? What sets off the contraction? Why does the P wave show up? Can you all have any idea? Why does the P wave even show up? Norma or Janie, do you have any idea why the P wave is represented?
I'm trying to open the book, but
Come on, ladies, you can do this.
like a weird page. I don't know how to open it.
Think about it. Where does the electrical impulse start? Where does everything start? What part of the heart or the electrical system begins all the impulses?
The SA knot.
Any idea? It's the SA node. Remember the SA node, the sinoatrial node. Okay, I just saw Janie post it. Yes, the SA node is the one responsible for initiating the impulse. So whenever you see an EKG, right away, let's look for the P wave. Is the P wave present? Yes, that is it's going to be a sinus node, or we call it a regular node, a regular EKG. We call it a sinus rhythm, okay? So if you see a P wave, you're gonna call it a sinus rhythm. Sinus rhythm. Remember that, or write it down. If you see a P wave, sinus rhythm. Next, we're gonna determine the rhythm, okay? The rhythm of the EKG. Are all the R waves occurring at the same time? This is where your calipers come in real quick, right? You get your calipers and you look at the P waves. You're going to put it from the beginning of the P wave to the beginning of the next P wave. So you put your calipers in on the paper and you put them in, and then you take it to the next one and you do the same thing and you make it to the next one. Or you can put them on the R's, on the tall R's waves. Put it on each R on the peak, on the very pointy part. Measure it like that. And that's going to tell you if this is a regular rhythm. All right, regular rhythm. So first we have to find out if it's a sinus rhythm, and then we have to find out if it's a regular rhythm. Okay, this is step one. Okay, so tell me, type your answer. How do you measure, how do you determine if this is a sinus rhythm? How do you determine that? Tell me. Write in and type your answer. How do you determine when a rhythm is sinus? And how do you determine when the rhythm is regular? Okay, so that's step one, guys. Please make sure that you write that down. There's only 5 steps, so if you have to write them down, write them down. There's only 5 steps. So you have to determine the rhythm of the QRS complex. We said you put your calipers on the very tip of each R wave, and then you measure them. If there's at least one QRS that does not match, okay, then you have an irregular rhythm. Irregular rhythm. So P wave are all regular. They're happening at the same time. R waves happening at the same time. So P waves are present and the R waves are regular. Then you have a normal sinus rhythm. Normal sinus rhythm. Okay, that means you have a regular rhythm and the signal is coming from the SA node. So it's very important, okay, that you remember this. This is step one. So every time again we look at each EKG, if you don't even know what the heck you're looking at, you start right here. Step one. Determine if it's a sinus rhythm and determine the regularity. Okay. Are we ready to move on to step two, or do we have any questions here? Norma and Janie, do you have any questions? No questions? Okay, we're going to move on to step two. Step two is determining the atrial and ventricular rates. Atrial and ventricular rates. So, like I said earlier, if there is a problem in the coordination of the electrical impulse from the SA node to the AV node and down to the ventricles, if there's any problems, right, any blockage or obstruction or whatever, or sometimes the atria are disrupted and they start their own rate, then you're going to have two different rates. So we're going to have to make sure that we calculate. The other day, I believe it was on Wednesday, we learned how to calculate the ventricular rate, right? There's 3 different methods. We call them the 300 method, the 1500 method, and then the 6-second method. So remember that. Go back and look at those notes and remember how to calculate it because it will be required. So the atrial rate is determined by the P to P wave interval measurements. That means that you put your calipers on a P wave and then the other pin on the other P wave. And you're going to determine that, okay? The heart rate must be determined for both atria and ventricles. And you do this by using the calipers. The atrial and ventricular rates are usually the same. However, the rates may vary due to conditions occurring in the heart. So, a regular rhythm can be calculated by using the 300 method or the 1500 method, either or. 300 or 50, this is for regular rhythms. But if you run into irregular rhythms, then you will have to use the 6-second method, okay? Why? Because remember that when we were counting the 300 or 1500 method, you have to count the big boxes. And if these are irregular, then you have R's that are going to be close, and then you have another R that's going to be further apart, and so on. So it's not going to be accurate. So that's why when we have irregular rhythms, you use the 6-second method. Remember that. Regular rhythms, you can use the 300 or 1500 method, whichever one it's easier for you. Of course, the most accurate is a 1500 method. If a heart is going over 100 beats per minute, we call that tachycardia. If a heart is going below 60 beats per minute, then we call it bradycardia or a slow heart. Now, there's a lot of people that have slow hearts for many reasons. One, it could be they have a very good physical condition. They exercise a lot, so their heart is always slow. We have some athletes that do those triathlons. They swim and bike and run and do everything. Those guys have an incredibly strong heart. So, with 40 contractions, their heart can do the same job that ours can do in 70 contractions. That's how strong their muscles become. They're myocardiums. So they're very, very efficient. So one contraction can put out, 70 milliliters, and our hearts require 70 contractions to put out 70 milliliters, per minute. So that is why we have to have good physical condition. So again, make sure that you know which method to use when calculating the rhythms. Okay. Again, a regular rhythm is determined by the consistency of the P waves or the R waves. You have to make sure.
Sir.
If there's any missing P waves or any missing R waves, then you have an irregular rhythm.
Sir.
All right, do we have any questions here? This was step 2, okay? So again, step 1 requires that you determine, yes, someone has a question. Okay, so again, identifying the P wave morphology is very important. Look at the structure, look at the shape. Does it look nice and round? And are the P waves present before every QRS? That is very important that you make sure that it happens. Does each P wave have a QRS complex following it? If there is no QRS next to the P wave, that means something happened. A P wave was dropped. A P wave did not make it down the electrical pathway all the way down, so it wasn't captured in the EKG waveform. So it's really important that you remember that. That was step 3. Super simple. Just make sure that the P waves are present, pretty much. Okay. What do you call a rhythm that does not have a P wave? If it does not have a P wave, you're going to call it an arrhythmia. Arrhythmia. A means without, rhythm. An arrhythmia. That means it has no rhythm. It's like if you don't know how to dance, you have no rhythm. Okay, so please make sure that you remember that. If you're a good dancer, then you're a normal sinus rhythm. If you're a poor dancer like me, then you are an arrhythmia. And that's step 3, identifying the P wave morphology. Look at the shape, the overall structure, and then make sure that it's present before every QRS. That's step 3, super simple. The next one is the PR interval. The PR interval. The PR interval is a measurement using your calipers from the beginning of the P to the beginning of the R. Okay, that is a measurement, super important. What does that represent? It represents the electrical impulse traveling from the SA node to the Bachmann's bundle, okay, to the AV node, to the AV node. That is the amount of time that it takes to travel from the SA node to the AV node. That is what you're seeing on the paper. How long should it be? The PR interval should be between 0.12 and 0.20 seconds. 0.12 and 0.20 seconds. Very important. This measurement, write it down. Okay, write it down. PR interval is equal 0.12 to 0.20 seconds. How many little squares is that? We have 3 little squares and 5 little squares. So the PR interval should be between 3 to 5 little squares, no more than that. If it's taking longer, what does that mean? If the PR interval is longer than 0.20 seconds or than 5 little squares, what does that mean? What does that tell us? What does that tell you in the electrical signal? What is it telling you? It's telling you that it's taking longer than usual, right? If it takes you from your house here to Careers Unlimited, if it takes you 20 minutes all the time, that's normal. 20 minutes, 20 minutes, no problems. But all of a sudden, you're taking 25 minutes to get here. Why? Why is it taking you longer here? Well, there's got to be a reason. Well, pues, mile 2, mile 3, all this traffic going on, right? It takes you longer. So same thing here. The impulse from the SA node to the AV node is taking longer, and that is a problem. Why is it a problem? Because the longer you take, right? You take longer from home here, that means you're going to miss out on class, right? In the electrical tracing, the impulse is taking longer. That means that your ventricles are going to take longer to contract. So that means as a result, what's going to happen to your heart? Is it going to go faster or is it going to go slower? Can you all tell me? Is it going to go slower or is it going to go faster? What's your answer?
Question, sure.
The question is, if the impulse from the SA node to the AV node takes longer than 0.20 seconds, is your heart going to beat faster or slower?
Slower.
That's correct. Janie, you're also correct. It's slower. So you guys following, right? So the impulse has to stay within that range, 0.12 to 0.20 seconds, or 3 little boxes to 5 little boxes, which is easier to remember. So again, that is your PR interval, beginning of the P to the beginning of the R. You got a measurement. That's why we need those little calipers. That was step 4, guys. That was step 4. We're already in step 4. What was step 1? Step 1 is what? Do I remember? Did you write it down? Think about the dancing part, right? The dancing part. Step 1,
Determining the rhythm
the rhythm, right? How do you determine the rhythm? How do you know it's a normal sinus rhythm? How do you know?
with the calipers.
Nope. All you have to look is for what? What do we look for?
The P wave to be
The P wave. If you see a P wave, Janie, what does that tell you? If you see a P wave, what does that tell you? What part of the heart is working normally? You said it earlier. I think you said it earlier. Your what? Your SA note is correct. Your SA note. So that is the very first step. And then the regularity. How do we measure the regularity? What do we have to measure?
From the P wave to the next P wave.
Exactly. Or,
the R wave to the R wave.
correct. Very good. Very good. You guys are paying attention. So yes, that is how you're telling me. So you call this a normal sinus rhythm. Normal sinus rhythm. When a P wave is present and all the R's and all the P's are happening at the same time. And then step 2, we said, is determining the atrial and ventricular rates. And we said that we have to count those, right? Using the 3 different methods, 300 and 1500 for regular rhythms, and the 6-second method for the irregular rhythms. The third step is looking at the P wave morphology. Not just look at the shape of it, make sure it's nice and rounded, all right? Or that they all look the same, but also that they're present. Every P wave has to be present before what? Before the next wave is called what?
Doris.
R wave.
Yeah, QRS or R wave, yes. The QRS has to be present all the time after each P wave. If not, then there's a problem. If there's no QRS, that means that your ventricles did not contract. And obviously that is a huge problem. Step 4, we said measuring the PR interval. You just count the little squares. It has to be between 3 little squares to 5 little squares, and that is it. The PR interval. Very important that that signal travels from your SA node down to your AV node, right before the ventricles are going to start contracting. And then the last step, ladies. The last step is measuring the QRS duration and analyzing the morphology. We said before that the QRS is represented by your left and your right ventricle depolarization, right? So you have your triangle, right? You have your left ventricle contracting, so you have this energy spurt, and then you have your right ventricle contracting, and you have another one. So they should look identical. What is the measurement for the QRS? What is the measurement for the QRS? There's a measurement that we have to learn, just like the Pierre Erneville. You have to make sure that your QRS is between 0.06 and 0.10 seconds. 0.06 and 0.10 seconds. That's 1.5 squares up to 10 is 3 little squares. 1.5 to 3 little squares. So it's very, very narrow. Okay, narrow, but not too narrow. Okay. What happens when you what do you all think is happening when you have a wide QRS? Your QRS becomes wide.
It's taking longer.
Okay, where is the impulse traveling from? From your AV node down to your left and right bundle branches, right? So that impulse is taking a little longer, even if it's 2/10 of a second, I don't know, 0.14, you know, that means that that impulse is being slowed down for some reason. And we're going to discuss that. And there's a chapter specifically talking about ventricular dysrhythmias that we're going to talk about. Okay. So measuring the cure's duration and the morphology. Again, what does the morphology mean? What does that mean? What does morphology mean? It means the shape, right? The shape of the wave. Okay. If you have one side of the QRS looking nice and straight, and then the other one looks like a little peak, like a little mountain, right? That is a problem. It could be on this side looking, or it looks round, or it just looks weird. All right. And the other one looks completely normal. Then you have one side of the heart not getting the impulse. The impulse is not traveling normally like it does. So it's going around, or it's being blocked and takes away around, and so again, we're going to look at chapter, I remember what chapter it is, ventricular dysrhythmias, later on. So it's important that we look at the morphology and also the duration of the QRS. Super important, because that is the ventricles. If the ventricles are not contracting normally, we're going to have a huge problem. Okay, we're going to measure the QRS by putting it at the where it starts, right on the left side on the first, and then the other one you're going to put it on the J point. The J point. Where is the J point? Where your S wave starts. Where's your S wave? Your S wave is, you have a Q. Sometimes you have a Q, sometimes there's no Q, right? It's a little dip, and then it goes up R, and then comes down below the isometric line. It comes below that, and then right before it starts, that is your J point. That is your J point. And once it goes up, that's your S wave. Okay. Q, R, S. So you're going to measure that. In other words, pretty much from one side, one corner to the next corner. They're very visible to measure. So what are the measurements of the normal QRS? What are the normal measurements? The duration. Tell me what that is.
0.06 to 0.10.
Correct. Yes. That is normal. So remember that, super important. Just 1.5 to 3 squares. It's a very narrow. All right. We've talked about the 5 steps. Okay. So what is the first step again? Tell me the first step to evaluate an EKG rhythm.
Determining the rhythm.
The rhythm, and what else?
And the regularity.
The regularity. The rhythm and regularity. That is the very first thing you're going to look at. Don't get distracted with else. Follow these little 5 steps, and for sure you're going to be, very, very close. Okay. So Rhythm regularity. The next step is to do what?
The ventricle rates.
The atrial and ventricular rates, and you're going to measure those, right? How do we measure? What method do we use to measure an irregular heart rate?
The 6 second.
A 6 second is correct. Very good. And you use a 3 and 500 for normal rhythms. How do you determine if you have a sinus rhythm? How do you determine that? The presence of what?
What was the question, sir?
How do you determine a normal sinus rhythm? How do you know it's a normal sinus rhythm?
The P wave.
The P wave is present. Very good. That means your SA node is firing, right? So there's going to be a P wave. And you say it's a regular rhythm when there is all the R's are the same and all the P's are the same by measuring them. Okay. So we say, well, step 1, step 2 is counting the rate. Step 3 is what? What's step 3?
Identify the P wave.
The P wave morphology. So once you know that there is a P wave, you have to look at the shape, overall shape, right? But not only that, you also have to look for what else? Make sure that what? What follows the P wave? What has to follow a P wave?
The T.
No,
The QRS.
the QRS. Correct. The QRS has to follow the P wave all the time. If there's missing QRSs, that is a problem. Okay, that means your ventricles are not and your atria are not coordinating the same. And then we said we're going to measure the what? The PR interval. What does the PR interval represent? What do you think it represents in the EKG? I said that it represents the amount of time of what?
A contraction.
Nope. The amount of time the what? What's traveling down the pathway from the SA
The
to the
AV node to the bundle of branches.
That's after, no, right before that. The PR interval represents the impulse traveling from your SA node to your AV node. Just like I said, if you all come from your house and it takes you 20 minutes to get here, right? That's all every time it's going to take me 20 minutes, so I need to leave right now. So before class starts, right? So you make sure that that impulse travels the same, gets there, arrives at the same time every single heartbeat. Just like you all, right? When traveling from point A to point B, you know how long it takes you to get from your home to your kid's school. Oh, it takes me 10 minutes, so I better get going, right? So you have to. So the PR interval represents the impulse traveling from your SA node to your AV node. And what is the normal time duration of the PR interval? What is that? You have to know this number.
What was the question?
What is the duration of the PR interval? How many little squares? What is the normal duration for your PR interval?
0.12 to 0.20 seconds.
That's correct, right? Which equals how many little squares? How many little squares?
I think you had said 3 to 5 little boxes.
That's
Um,
correct. Because each little box is 0.04. So if you add 3 of those, you got 0.12. If you add 5 of those, then you got 0.2, right? 5 little boxes equals 1 big box. Okay. All right. And then the last step we said is measuring the QRS duration and the morphology. The QRS duration. What is the normal duration for the QRS?
0.06 to 0.10.
Very good. Okay. And then the morphology or the shape of the QRS. Okay. If they're not looking the same, exactly the same, then you have a problem in the impulse traveling to the left or to the right, depending. Like I said, there's a complete chapter just on that. A regular rhythm has 19 small boxes between two consecutive P waves. What is a heart rate? If a regular rhythm has 19 small boxes between two consecutive P waves, what is a heart rate? Can you all calculate that? $19 small boxes.
In 2 seconds?
No. No, you're gonna calculate the heart rate, right? Remember, you have an R and you have an R, and you have 19 little boxes in between them. What do? How do you calculate it? Use the whatever method is
3
easy.
methods, no?
Yeah, you can use the 300. Remember, a regular rhythm, so you use 300 or 1500, whichever one you want to use. There's 19 little boxes in between them. So do the math real quick. You divide 19 into 300, or you can divide it into 1500. Actually, you have to divide it into 1500, right? Anybody? I'm looking for my calculator on my phone. There it is.
So we divide 1500 by 19.
Correct. That's
I
correct.
got 78.9.
That's right. That is a very accurate heart rate, right? 78.9. It's between the normal ranges, between 60 and 100, completely normal, right? Okay, after you measure the QRS duration and morphology, what other questions need to be answered? After you measure the QRS duration and the morphology, so you measure the QRS, it's normal between 0.06 to 0.10. What other questions do you have to ask yourself? Are all the QRSs complexes of equal length, right? So you get your calipers, you get a QRS. They're all pretty much normal. What is the actual measurement, and is it within the normal limits? And do all QRS complexes look alike? Remember that you have to look at a 6-second strip, right?
So you need to ask if what's there?
You need to ask, are all the QRS complexes of equal length? That's on page 128. Are all of the QRSs pretty much, do they measure the same? That's all you got to ask yourself, okay? You also have to ask yourself, what is the actual measurement? So you measure with your calipers. Oh, it's like, four little squares, that's 0.12, okay? It looks a little bit wide, but 0.11, it's okay. It's not too bad. And are they all measure the same? If there's one narrow and there's narrow widers, then there's a problem there. And lastly, do all QRS complexes look alike? Okay, are they all like twins, exactly alike, or some of them look a little bit different? Some of them have a little peak, or they all just look a little like a little cone? That's all you got to ask yourself. All right. Okay, I'm gonna give you a few minutes, 10-minute break, so you can kind of take that all in, get some coffee, go watch your kids or something. 10 minutes, and we're gonna be right back. All right. The steps that we just talked about, the 5 steps, are we're going to be using to determine what rhythm we're looking at, and we're going to start looking at the most basic ones. So the criteria for classification, again, the rhythm is going to be number 1, the rate, the P wave morphology, the PR interval, and the QRS. Those are the 5 things that we have to look at, and they're on page 130 on the top. If you look at them, those are the 5 things that you have to make sure that you number one is the rhythm. Oops. Type rhythm. The intervals between the 2 PPs and the RS. Number 2, the rate. How to calculate the rate. We already discussed that. The P wave morphology or shape. Number 4, the PR interval. And number 5, the QRS duration and morphology. Those are the 5 things that we're going to use to evaluate every rhythm that we looked at, the pretty much what we talked about in the last section. So how is the patient affected, and what should you know? How is the patient affected when the electricity, the impulse do not travel the same way it does with every other, right? We said that the formula for determining cardiac output. Remember what cardiac output is? Cardiac output is the amount of blood that is pushed out of your heart every minute. And we calculate cardiac output how? How do we calculate cardiac output? Equals what? Heart rate times what? 70. So you calculate your heart rate times 70 and it'll give you an average, right? This is an average of what adults push every minute, okay? We said a stroke volume is amount ejected from heart with every stroke or beat. So let's look at how is a patient affected when they have an arrhythmia? The cardiac output is the volume of blood the heart pumps each minute, and stroke volume is the volume of blood ejected by one or both ventricles with each contraction. Okay, so we have a good idea of how much we do. Because the average ventricle ejects 70 mLs of blood with each contraction. This is a normal rhythm. What causes decreased cardiac output? So I want you to remember this, Janie. Decreased cardiac output is what you have to think, right? If there is less blood coming out of your heart, how is every part of your body affected? How does it affect your mind, your head? Well, if there's decreased blood to your head, you might possibly faint. But before you faint, you might feel dizzy. You might feel confused. And if you do faint, you're gonna lose consciousness, right? You're not gonna be alert. You're gonna be, obviously unconscious. You might have a change in your mental status. Again, it means you may be confused. We're not talking about fainting. You might just be confused. And think about an older person. Older people do not have the same strength of heart that young people like you all do. So if there's a decreased amount of blood going to the brain, they might start to get confused. They might start saying things like, just off things that are not pertinent to the day. They don't know where they are. They don't know what they're doing, or they might act differently. So if you ever note that, then obviously you have to report it. So decreased blood flow, okay, affects your neurological system, which is your brain and everything else. But it also affects, obviously, your heart. If your heart does not pump enough blood, it's going to affect itself first because it's right there. I mean, your heart is the one feeding itself. So if it doesn't have enough blood to pump to itself, then you're going to have symptoms of what? Chest pain, palpitations. Your heart feels like it wants to pop out of your chest. You have chest discomfort. And in the long run, over many years, people develop congestive heart failure, which is one of the most common problems that you're ever going to see. Congestive heart failure. And we're going to talk about that later because it's one of the most common things that you'll see. How does it affect your lungs? Remember, your heart, the right side of your heart, your right ventricle and your atrium, or your right ventricle, rather, pumps blood to the heart, right? Deoxygenated blood. But then your left ventricle pumps blood to all your body. So how are your lungs affected when they don't receive enough blood flow from the heart? Well, obviously you're going to have trouble breathing, shortness of breath, fluid in the lungs. Sometimes when there's too much fluid in your circulation, it backs up to the lungs. and your lungs get congested with a lot of fluid. Okay, think, remember, your lungs are like a piece of meat, but inside they're expandable. So when you breathe, they expand and they come back, expand and come back. So if your heart is unable to pump enough blood for the gas exchange to happen in the lungs, then you're going to have decreased oxygen, which is going to get you confused and short of breath, and you feel anxious because you can't breathe. So your lungs depend also on your heart to deliver enough blood flow to them so they can continue to do their job. Okay, so that is how the respiratory system is affected. What about the kidneys? Are the kidneys affected by the lack of blood flow or by an arrhythmia? If your heart is not pumping enough blood to the kidneys, are they affected? Yes, very much.
Yes.
Yeah, remember your kidneys are responsible to filter your blood and remove the excess fluid in your circulation. If your heart is not able to pump blood to the kidneys, how are the kidneys going to remove the excess? Well, they don't. So what happens to all that fluid? Well, it just builds up in your body. Over a few days, it builds up and builds up. I have a lot of examples in where I work. You know, have all these patients that have heart failure and then have kidney failure. You know, they have lung problems. So all in one. So imagine it's all in one. It becomes very complicated to manage these people or their medical problems. So decreased urinary output. If the kidneys do not get blood, what are they going to filter? So you have decreased amount of urine getting out. So every person should at least produce 30 milliliters of urine per hour. So if you work 8 hour shift, how many milliliters should a person urinate at least? 8 times 30, that's 240. That is 1 cup, right? So a person must urinate at least 240 to 300 milliliters every 8 hours. And we measure it in 8 hours because that's usually a work shift, right? So that is a lot. Yesterday I had a resident. She only urinated 50 mLs. 50 mLs. That is not normal kidney function. Or is
In the
it
whole
the,
day?
huh?
15 the whole day?
No, 50 in 8 hours. 50. It's not enough. So what happened? Is it the kidneys that are not working, or is it the heart that's not working? Which one? Or both? In her case, it's usually the heart that is not working. Her heart is just too too weak. It does not pump enough blood to the kidney so they can remove the excess. That is her problem in that case. And that's because she's always laying down. What about the circulation, the peripheral, or call it systemic circulation? Remember, we said we have pulmonary circulation, we have systemic circulation, and then you have the coronary circulation or your heart circulation. All right. So, what happens when all your body does not get enough blood? What happens to you? Well, your blood pressure is going to drop, right? Your blood pressure is going to drop. You turn pale, you get real pale when somebody doesn't have enough blood flow. I don't know if you ever seen somebody that's about to faint, they kind of turn pale. That's because there's not blood flow to the skin. That's why the skin changes color. The skin becomes very cool, cold, and sometimes it gets sticky and sweaty. Okay, we call it clammy. Clammy. It becomes clammy or sticky because of the lack of blood flow to the skin. So those are some of the changes that we can see in the systemic system. If there's not enough blood flow down to the legs, to the arms, your blood pressure is low, you have a pale color and so on, then obviously you got a problem. Okay, you got a problem. So those are some of the changes that you notice when a person has decreased cardiac output. Super important, guys. If you can learn this, you can really help someone prevent complications. You have to make sure that you keep an eye on these symptoms, signs, things that we see, and symptoms where the patient tells you, right? The patient tells you. So that would be the signs of decreased cardiac output, because that's what we're concerned with. Now, it may not be an arrhythmia. Maybe the person already has very bad, a weak heart, congestive heart failure. That is an arrhythmia. Okay, so again, so let's look at page 131. I'm not sure if y'all looking at that. Are y'all looking at that online?
Yes.
Okay, very good. So you can see the rhythms, right? The questions on page 131. It says, number one, using the criteria for classification, select the rhythm that most closely resembles a normal sinus rhythm, A or B. Tell me your answer. Tell me your answer. Which one resembles mostly a sinus rhythm? What's your answer? Anybody post the answer?
B.
B? Okay, B. Using the criteria, let's make use of the criteria, okay? What is the rhythm? Is this a normal rhythm or irregular rhythm? Tell me, please. And why?
Irregular.
Irregular or regular?
Irregular, I think.
Why is it irregular? How do you determine that?
I think it's regular because I can see the P wave all the way to like the QRS complex.
Very good, Janie. Very good. Exactly. You have to look at the P wave. If there's a P wave present, that means that is a sinus rhythm. Okay, that is a sinus rhythm. And you look at all the strips, like you said, you look at all the a 6-second strip, and you can tell P wave followed by QRS. Remember, not just a P wave, but there has to be QRS after it. P wave, P wave, P wave, all the way down. So that is a sinus rhythm. Now, is it a regular rhythm? Is it a regular rhythm? And how do you determine the regular rhythm? Y'all should know this one. You just have to go back and remember a little bit.
What was the question?
The question is, how do you determine if it's a regular rhythm?
By the P wave?
By the P? Nope. The other one,
QRS.
the QRS. What about the QRS? What do you have to do with the QRS? What do we have to do with the QRS?
Measure.
You have to measure it, right? You have to make sure that it is that these are the same, right? That they're falling on the same, at the same time, right? So you have to use your calipers for this. I'm trying to make it bigger. What page am I here? What's on the next page? Okay, next page. There it is. All right, so you have to measure what? With the calipers, P to P, P to P, P to P, and then
And
R.
R to R.
Exactly. That is how you determine the regularity. So we know it's a sinus rhythm and we know we have a regular rhythm. Very good. So we have a rhythm. And now what is the rate on this one? Very easy to calculate. What's the rate on this one?
On which one? A or B?
Well, you said B, right? Did somebody say B? One of you said B.
Yes,
I
I
think both
said
of us.
Okay. What is the rate on this one? You can use any method you want. If it's a regular one, you can use the 300 or the 500. Let's use the, you can use the 300 method, okay? You count the big blocks and you divide it. Or why don't we do this? Janie, do the regular rhythm. I mean the regular, the 300 method. Count the big blocks and divide them into 300. And Norma, count the little blocks, the little squares, and divide it into 1500 and give me the heart rate.
So I count the little squares.
Yes, and divide it into 1500. I'm trying to make this bigger.
I don't know. I don't know how to count the little squares.
Yeah, the little squares. If you have one, are you looking at my pointer? Right here in the middle of the page?
Super small. Can you zoom it in?
That's what I'm trying to do, but for some reason I can't.
Make it full screen, sir.
Full screen on the.
And the 3 little lines on top where the search bar is at.
Oh, thank you very much. There you go. So sorry about that. Okay,
And then zoom it in.
and then zoom it in. Norma, where's the zoom? Do you see the zoom?
Just click the screen and then it'll come out on top.
Usually, right?
Or you could just like tap the mouse and it'll.
Very good. Wow, damn. Is that Norma? So there you go. So now you see. Can you see my pointer?
Yes.
Okay. To use the 1500 method, Norma, remember what do we have to do? We have to count the little squares. So if you can't count the little ones, so you count the big ones. One big one is how many little squares? 5. So we got 5, 10, 15, and let's say we got about 4. So we got 19. 19 little squares into 1500. What is the answer? I think we did that earlier.
79.
About 79, exactly. Did you already calculate, Jenny?
Sure, I was gonna ask a question for the 300 method. The boxes have to be complete.
Yes, they have to be complete.
Mhm.
That's why it's not very accurate. But you can use either of those two with regular rhythms. Now, if we have an irregular rhythm, then we cannot. We cannot. If these R's don't match, they don't match like this. Remember, we get the calipers and we put it over each one. You can put it on the first one and the second one, and then just move the caliper to the next two, and then the next two, move it over, and they should all be exactly the same. And that's your regular rhythm, okay? Same thing for the P wave. P wave, put the calipers from P to P and measure it, you have a regular rhythm, okay?
And if it were to be irregular, we would use a 6-second.
Correct. You count 6 seconds. So here we have 6 seconds. We have 15 large squares, 15 large squares. This is a 6 seconds, okay? That's what we're looking at here. I think, let me see. 3, 4, 5, 6, 7, 8, 9, 10. Yeah. You have 30 large squares equals 6 seconds. All right. So we have
I
the,
got 75 with the 300 method.
see, it's not very accurate. Okay, 75 to 78, still pretty close. See, but at least you know now how to calculate the rate. So we have, is the rate within normal? Is it within the, yeah, what is the normal parameters for a heart rate for adults? 60 to 100, correct? 60 to 100. So 78 is right in the middle. So we have a rhythm, we have the rate, and what about the P wave morphology? What do the P waves look like? Do they all look the same? About the same, right? See the P wave?
Yes.
Okay, your P wave is always the first wave. The first, we call it upward or positive deflection. Up, and then we have a little Q, R, S, and then you got your T wave. P, Q, R, S, and then you got your T wave. All right, so it looks like we have a normal sinus rhythm. Your P waves look completely the same, completely normal, and there is a QRS after each P wave. P wave, QRS, P wave, QRS. Remember we said that's important too. P wave, QRS. If there's a R missing here, then we got a problem. P, QRS, and so on. So we have the P wave morphology, and there's a presence of QRS after every P wave. Next step, we already covered three things, okay? Now the PR interval. Remember, we have to measure it from here to here. What is the normal measurement for the PR interval? What is the normal measurement for the PR interval?
0.12 to 0.20.
Exactly, exactly. 0.12 to 0.20 or 3 little squares to 5 little squares. So you measure it from here to here, and it's about 3 little squares. I can't see it that well, but can you tell? It's like 1, 2, 3. So it's 3 little squares. So it's within normal ranges. So the PR interval is normal. And remember, the PR interval tells us, it tells us how long the signal from the SH to the AV node is taking, right? Which is 0.12 seconds. That's like a little blink of an eye. So you determine your PR interval. Here, normal. Here, 1, 2, 3, normal, and so on. Sometimes you're going to find there's certain arrhythmias that we're going to talk about where the PR interval becomes longer and longer and longer, right? There's an arrhythmia. And then we're going to talk about another one that's very similar, but then boom, one QRS is missing. So we'll get to those later. Right now, we're trying to determine, okay, the normal sinus rhythm. And the last thing we have to evaluate is the QRS duration. How wide is the QRS? How wide? Can you all tell how wide this one is? That's pretty close. I think y'all can tell, right? How wide is the QRS? How many little squares? Are y'all there?
I think it's 1 or 2. I can't really see.
1.5, right? Más o menos. 1.5. That's exactly 0.062. Point what? 0.10. To 0.10 is the normal QRS duration. So it's this QRS happens very quickly. What does the QRS represent? It represents your left and right ventricles contracting at the same time. At the same time, they contract really fast, right? So here we see the left and the right ventricle contracting. This we call the QRS complex. We call it a complex because it's 3 waves in one. It's your Q, your R, and then your S wave. QRS. That's what we call it, a QRS complex. So does it look, do they all look kind of about the same? First, you got to measure the duration, right? The same, 0.1, yeah, about 1.5, 1.5. Okay, they're all good. They're all 1.5 wide, so no problem there. They all seem to be about the same height. Okay, they're all good. The morphology, boom, I'll go up, perfect. They all look good, no problem there. So your QRS duration and morphology are within normal. So you have a completely normal sinus rhythm here, normal sinus rhythm. So you have to be able to recognize a normal sinus rhythm so that you can recognize an abnormal sinus rhythm. Okay, so let's look at this one. What is wrong with A, letter A? What's wrong with letter A?
It's too long, like the in between the.
Okay, let's take a look at the criteria. Janie, is it a rhythm? Is it what is a rhythm? Is it a sinus rhythm?
No.
Why not, Norma?
I think it is because it still has the P wave and the QRS.
That's correct. Very good. It is a sinus rhythm because there is a P and all the QRS follows it. So you're correct. Let's take it the second criteria, the rate. What is the rate? Use the 6-second method. In the 6-second method, all you do is do what?
Count the the R.
The R times?
So times 10 to be 40.
40. Is that a normal heart rate?
No.
No, it's too slow.
Too slow. So what do we call a slow heart? What
Is
do
that the one bradycardia?
Exactly. Bradycardia is correct. So because it's a sinus rhythm, we call it sinus bradycardia. Sinus bradycardia. Is this a regular rhythm? Are they dancing at the same time or are they off? What do you do? How do you determine if it's regular?
You use the caliper?
It's calipers, right? And you put it on every R. You can put your fingers right here on this one. Put two fingers on the screen and you can tell that they happen at the same time. They're just happening slowly. So this is a normal sinus bradycardia. Bradycardia, slow heart rate. And again, you go through all the 5 criteria, guys. You have to
There,
use
so then both of them are sinus rhythm. A and B.
exactly, except the first one is called sinus what?
Bradycardia.
Sinus bradycardia. And if it was going over 100, what do you call it? Sinus tachy,
Tachycardia.
tachycardia, exactly. Fast heart rate. So again, this is all the 5 steps. Is what is the PR interval? You measure it. Just get your calipers from the beginning of the P to the beginning of the R, and you measure it. The little P to the R. Measure it, and they all look the same, right? They should be between what? Point one, how many little squares? 0.12 to 5 little squares. So this one is 1, 2, 3, 4, I think 4 squares. So it's about 0.16. It's within normal, right? So you have to measure it. And then lastly, you measure the QRS, 1.5, 1.5, 1.5, and so on. So they all look, it's just the only problem we see in this one on letter A is the rate. It's slow. Other than that, it's a normal sinus rhythm. Normal sinus bradycardia. Any question on this one, ladies?
No.
No, very good. Okay, let's move on because we got to finish this. So we already talked about sinus bradycardia, right? You guys already know what sinus brady. Look, it's right there. We already talked about it right now. We got ahead of ourselves, but that's fine. Okay, which one of these, A or B, is sinus brady?
B.
Exactly, B. Very
B.
good. Is there anything wrong with letter A? Quickly, look at it. Look at the criteria. Is the criteria
No.
the rhythm? Remember, measure it. Measure the R's. Is there a P wave present?
Yes.
Yes. And then you calculate the rate. What is the rate on this one? When you calculate the rate, ladies, make sure that all the waves are complete. Like you have P, QRS, and then T. If there's one missing, then you don't count that one. Okay? P, QRS, and T. Like on this last one, see how it's incomplete? You don't count that one. So it'd be 1, 2, 3, 4, 5, 6. 6, you have about 60 beats per minute, which is normal. P wave present, PR interval, you got about 1, 2, 3, 4, which is 0.16. Same thing here, and so on. So we have a normal sinus rhythm on letter A. And letter B, we said that is a what? What is letter B called?
Sinus biocardia.
Bradycardia.
You forgot the R, Norma. Bradycardia. Like Tom Brady from the football team. Okay, look at this one. What's the next one? What does this one look like? Let's go to the criteria real quick. Oops. What does A look like?
Like it's going fast.
Like it's going fast. So let's look at the criteria. Let's try to get used to doing the criteria, okay? So these are very fast. Remember when we talked about the speed of the paper? Okay, we talked about the speed of the paper. This is one of the times when you can increase the speed a little bit so they can separate it more. You can tell here there's a P, R, and then a T. P, R, and then a T, but they're very close, right? They're very close. So you look at the criteria, there are P wave, P wave, P wave, P wave, P wave. They're all there. And then you have the R present, R. Okay, so we have a sinus rhythm, right? Sinus means it coming from the SA note. Okay, then you look at what the rate. What is the rate of this one? Count all the R's, complete waves. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. 13 times 10 equals 100 and
30.
130. So what do we call this rhythm? It's on page 134.
Tachycardia.
Tachycardia. Tachycardia. Sinus, tachy, remember, if you have a P wave, it's a sinus. Tachycardia. And you have to evaluate everything else in between. The P wave morphology, it looks all the same. Yeah, they look all about the same. What about the PR interval? Is the PR interval the same? And remember, this is where the calipers come in handy. Measure one, and they have to be about the same. And then lastly, your QRS, duration and morphology. Are all the QRSs looking the same? Well, yeah, they all kind of look the same, and they're very narrow, 1.5, about 1.5 or 2 right here, 0.08, 2 little squares, one little square, and so on. So if the QRSs and morphology, they're all the same, then you have a sinus tachycardia. Sinus tachycardia. That's it. Any questions on sinus tachy, ladies? What is the only problem with this waveform? The only problem is the heart rate.
The paper speed. Oh.
Papers too. But the rhythm itself, what is the only problem that we see here? The heart rate. The heart is over the normal parameters. Okay. All right, can we move on to the next one? Do you have questions on this one?
No, we don't have questions.
Okay.
No, we can.
All right, let's go to the next one. See, it's kind of repetitive, right? They're kind of the same thing. Now, this next one is pretty much the same, okay? It's called the sinus dysrhythmia.
Can you zoom in, sir?
Yeah. The sinus dysrhythmia, here is the criteria for classification, okay? Why does sinus dysrhythmia occur? The sinus dysrhythmia is going to stay within the normal limits, okay? But is affected by vagal tone. Vagal refers to the vagus nerve, which is a nerve that we all have, and it sends information from the brain to the internal organs. In this case, the heart. If you sit down and meditate and relax, that vagal nerve is going to affect your heart, and your heart is going to slow down, right? If you are in the restroom and you're having trouble pooping, and you're there, uh, stressing, right? That's going to affect the vagal nerve, and it affects your heart. So your heart rate can actually slow down, right? When you're bearing down, when you're pushing and nothing wants to come out, that vagal nerve is going to decrease your heart rate because your heart rate automatically wants to go faster, but the vagus nerve slows it down.
Is it A, sir?
Hold on. Hold on. So we're talking again, why do we have sinus dysrhythmia? Because of the vagal nerve. Okay. when you breathe in and breathe out, I think one of you was doing the EKG, right? And we saw this. When they're breathing, you see a change in the EKG pattern. So when you perform an EKG, you make sure that you capture when the person is maybe not breathing for that 1 or 2 seconds when they're calm, and then take a picture. Okay, so let's look at the classification real quick. Okay, the rhythm, the interval between the PPRR wave occur at irregular periods. PP and RR occur at irregular periods. The rate is going to stay the same, be normal, between 60 to 100. The P waves are going to be present because it's a sinus. Remember, we call it sinus dysrhythmia. So there's always going to be a P wave present. The PR intervals should be the same because there is nothing blocking the signal from getting down, traveling down. So the PR interval is completely normal. And the UQRS should be within the same, 0.06 to 0.10. So nothing is interrupted. The only thing that is interrupted is the P and RR waves that are not happening at regular periods. Again, it happens when somebody is breathing. Okay, so let's look at, oops. Okay, using the criteria for classification, select the rhythm that most closely resembles sinus dysrhythmia. Which one would you say is sinus dysrhythmia?
I think it's A
Why do you think it's A?
because it's widened.
It's wide.
Yeah, like the P wave.
The P wave, is this the P wave or is this the P wave?
That one.
This one?
Yeah.
No, this is the T wave. Okay.
Oh.
Remember, the P wave is before the QRS. Here you can't, it looks like QRS is here. So that means this is your T wave, and then you have a P wave. See, P wave, QRS. P wave, QRS, and then your T wave over here. Okay. PRST. Got it? All right. So what is the problem with a sinus dysrhythmia? What is the main problem that you need to look out for? The only problem you're going to see is the irregularity between the P's and the R's. So if you measure with your calipers, P to P, P to P, they're going to vary. And the R's are going to vary. Count the blocks, the big blocks between the R's, and tell me if they're the same, exactly the same, or are they different? Count the number of blocks between the R's.
They're different.
A is different.
A is different, exactly. So this is a sinus dysrhythmia because everything else is the same, is normal, except the R's that are not occurring. Okay? Sinus dysrhythmia. So we have a P wave present between every QRS, P, QRS, P, QRS, P, QRS, and so on. The P wave, let's say the PR interval is normal, normal, normal. The QRS, normal, normal, normal. The only difference is that these are happening at irregular times. So sinus dysrhythmia. That is the only thing. Everything else should be the same. Any questions, ladies? Sinus dysrhythmia. This is the first abnormal one that we look at. So please make sure that you go over, right? Make a note, sinus dysrhythmia. Look for irregular PPs or RRs. All right. Can we move on to the next one? Do you have any questions here? Hello?
No question.
All right. So the next one. The next one is called sinus arrest. Sinus arrest. Okay, sinus arrest. Oh, actually, it's on the last page. It starts right here. Sinus arrest or a pause. We call it sinus arrest or sinus pause. Occurs when the SA node stops firing. Why would the SA node ever stop firing? That could be a serious problem. During the pause, no electrical impulse. There's no electrical. You see how this line here? Can y'all see this big old space? The big gap?
Yes.
There's no electrical activity at all. It's like somebody's dead for like how many seconds? I don't know, 2, 3 seconds. This is a
Is
sign.
that when the AV node takes over the next one?
You're
Or
getting
no?
ahead of yourself, Janie. You're getting ahead of yourself. Okay. When the SA node stops firing, remember every cell in your heart has the ability to take over. We're going to see on the next chapter that your atrial cells have the ability to start to take over. And not just one, but the fastest heart rate will take over. We'll go into that later, okay? For right now, sinus arrest means there's a pause, a blank, zero electrical activity. This could be a serious problem, right? If it doesn't reset again, obviously you're dead. But this is called sinus. What does sinus mean again? What does sinus mean? Not your sinuses like your nose. But what does sinus mean? It means that the electrical impulse is coming from your SA node. Okay, don't forget that. That is very critical that you remember this, okay? So critical that you remember this so that when you see sinus before a rhythm, you know that the signal is coming from the SA node, all right? So here is the criteria for classification again. In sinus arrest. So in a rhythm, the cardiac complexes are regular before and after the sinus arrest, but this rhythm is considered irregular due to the absence of electrical activity during the pause. There is no electrical activity. This is a problem. This is a serious problem. So, you know when it happens, guys? This happens to a lot of people during sleeping. Have you ever heard of people that have sleep apnea? Have you guys ever heard of sleep?
Those are the ones that need the machine in the nose, right? To keep on breathing for them.
That's correct. It doesn't breathe for them. It keeps the airway open and it pushes air into their airway, into the lungs. Because what happens if they're not breathing during the night? This is a big problem, guys. Big problem. Because during the night, your heart is not getting oxygen because your heart is stopping. You're not breathing for like, I don't know, 2 seconds, 3 seconds. That's a long period of time because in the mornings, you don't feel rested. You feel tired because your body did not get enough oxygen during the night. So a lot of people end up sleeping a lot during the day. I have a patient like this. He has severe sleep apnea. He does not use the machine. So what happens to him during the day? He's always falling asleep. Always. And I asked him, did you use a machine? No, pues que esto y que lo otro. It's like, okay, sir. And he doesn't understand that what's happening is that his heart is not getting oxygen either. So he's hurting himself 2 or 3 times. Not just his heart, but every other organ in his body, including his brain, that depends on oxygen, right? We live on oxygen. So again, the criteria here, the only thing is that there is no electrical activity during the pause. There's nothing. The rate is going to vary because of the pause, depending how long is the pause. So as you see here on this one, right? I don't even have to ask you, you can tell, right? Which one of these is sinus arrest? A or B?
B.
Right? You see that big pause right there. Why is it sinus again? Because there's P waves here. P wave here, P wave here, P wave here, here and here. So it's a sinus, right? The only thing that makes it an arrest is this long pause. What is the heart rate? What is the heart rate on this sinus arrest? What is remember for,
Because you count the R waves and then you multiply it by 10.
correct. What is the number again? How many?
50.
You could say 40 or 50, right? This is incomplete. So remember, this incomplete, you don't count it, right? So for this, you could say 40 or 50, it's still below normal. It may not be enough blood flow for your body to live on. Your body may not, you're not gonna feel rested. So this is what happens to my resident, my patient. His heart rate used to be super low. Now it's back to normal. However, he doesn't get enough rest at night because he has sleep apnea. So his heart may be doing the job, but his lungs are not helping because of sleep apnea. Okay, are y'all following so far? So the length of the pause needs to be measured to determine how long the heart has had no rhythm. So measure, place the calipers on the R to R interval and around the pause. Once the time frame is determined, calculate the length of time for the pause. So how long is the pause? Can y'all calculate it?
How do you calculate it?
Measure, count the big squares. Remember, one big square equals, I'm gonna make it larger, okay? One big square equals 0.2 seconds. So multiply 0.2 times the number of big squares, all right? Give me 1 second, okay?
I want to say 275 seconds. Oh, no. 2.75.
You count the big squares, no, Janie? And then he said to multiply it by 0.02, no, or something like that. I got 13 big squares. And then I think he said you multiply it by something.
From where did you start off? Because I got 10 big squares.
You need to start from the R wave before it died, I guess, to the last one. Well, that's what I understood.
I didn't hear him, to be honest. You said you did it 13 times 0.02. Why 02 if one little square is 0.04?
¿Qué?
That why did you say you did 13 times 0.02? Because the one little square is 0.04. So where do you get the 0.02 from?
I don't know. I think that's what he said. To multiply by. Ahorita que venga le preguntamos.
I had to step out really quick. So what was the duration of the pause?
Sure.
Mm,
The big squares and then we multiply it by what?
0.2.
0.2, Janie.
So it's 1, 2, 3, 4, 5, 6, 7, 8, 9,
Then
10,
it's 2.6.
12, 13. 13 big squares.
Yes, and then when you multiply it, it's 2.6.
So 2.6 seconds. That's how long this person was without a heartbeat. That means, right? That was the amount of time that he didn't get oxygen, he didn't get blood flow to the brain, to the lungs, and all that. So is this going to affect the way he's going to feel? Yes, depending on the length. If this goes on for more than 6 seconds, this is going to be a serious problem. This guy can actually stop. His heart can actually stop. So you have 2 point something seconds here. When it reaches or exceeds 6 seconds, it's going to be a medical emergency. That means that this person heart can actually stop. So it has to be reported, obviously, right away. Even one like this has to be reported. Okay, we cannot just leave it like unattended. All right. So sinus arrest, the only major difference, as you can see, is the length of the pause, long pause. Okay. What about the top one? What is A? What does that look like? We just covered it. It's one of the ones we just covered.
Sinus bradycardia.
That's correct. Sinus bradycardia. Very good, Janie. Very good. You can just spot it right away, right? El puro rate te dice todo, right? Just by looking at the rate, quickly look at for the P waves, P wave, QRS, they all look good. And the PR interval looks about normal, but you could always count it, right? 1, 2, 3, 4, 0.16, that's normal between was it 10 to 0.20. So right away you can tell what that is. All right. And it looks like, are we done? Oh my Lord. Are we done here? Ladies, if you can go back and read the summary. Look, this is everything we covered today. This is everything we covered. Okay. These are the most basic ones that you're going to run into. Okay. A normal sinus rhythm. Now you know what it is. You got to use the 5 criteria. Okay. To be able to identify them. Then slow heart, sinus brady, sinus tachy, fast heart rate, sinus dysrhythmia. Remember, all that is going on is the R's are happening at different times, but there's always a sinus, right? The P wave. So it's a sinus dysrhythmia, and then sinus arrest, right? The long pause, long pause. So if you know someone that has sleep apnea, encourage them to use the CPAP, the machine, to help them. Otherwise, they're going to feel tired all day. They're not going to feel rested. They're going to be falling asleep. They have low energy. Remember cardiac output? We discussed that earlier in this chapter. What are the signs of cardiac output? And it affects every body system differently. So that is why you see all these changes, okay? And the body's not receiving enough oxygen and blood flow. So very, very interesting. If you can understand the way the heart goes and the electrical impulses, the way they have to travel, you can understand a lot of other things that happen in the body. Very, very, to me, it's very interesting. I hope it's interesting for you guys. Because if you can understand this, you can understand anything in nursing. I'm telling you right now, anything in nursing. Alrighty, if you don't have any questions, I'm done. Please complete the matching. These are all online, your assignments. All right, we're already in chapter 5. I hope you've caught up already on the rest of your assignments. So please go ahead and complete those ASAP. I think today, until today, you have today to complete, what is it called? Chapter 4. I think I put a deadline for today. Now, how do I get it? Oh, here it is.
Sir, and are we meeting this week or no?
Yeah, I'm gonna find out when the other students are coming. That way we can hopefully get volunteers. I think it will, all of you got to practice at least, and then hopefully Raquel, the other student, can come in and also practice. So that I want students to come in here and so that y'all can use them as your volunteers. Okay, that's what I want. I want, like today Cynthia came. It's like, well, there's nobody else, so we cannot practice on other students unless they're coming in. So if there's any test, let me see. I hope everything should be open already. Okay, so you should be able to start your test on chapter 4. I believe even chapter 5 I already opened it, so you shouldn't have any problems with starting your quizzes or exams.
Okay, sir.
Alrighty, thank you all for coming in, and I went a little long, but at least we got it done. Okay, I'll see y'all on Wednesday.
Okay, see you on Wednesday.
Thank you. Goodbye.